Hi, I'm going to provide a little bit of background information that might help you complete this assignment. In doing so, I'll provide an overview of case conceptualization and talk a little bit about what you can expect to find in the reading that you'll complete for this assignment. But first, I want to begin with a brief discussion of diagnosis. Recall that diagnosis is the process of determining whether a particular problem experienced by an individual meets criteria for a psychological disorder as outlined in the DSM. In other words, identifying which, if any, diagnostic categories an individual's particular problems may or may not fit into. By knowing the mental health problems that an individual meets diagnostic criteria for, we might have an idea of the type of problem they're experiencing, the typical course of that problem, and treatments that may or may not tend to be successful for people who experience similar problems. But a diagnosis provides limited information. Think about the example of Lucy, the client for whom we watched a clinical interview with last class meeting. Lucy was experiencing a range of problems in her life, some of which were captured by the diagnosis of major depressive disorder, but some of which were not. One thing that Lucy was struggling with was academics and stress from an exam period that didn't go as well as she would like. Her parents were also getting divorced, an experience that was stressful for Lucy. Neither of those are diagnostic criteria for any mental health problem, but they're nonetheless important pieces of information that might help us understand the nature of Lucy's problems and are items that we might want to talk about and address in the course of therapy involving Lucy. Therefore, to fully understand mental health problems for individual clients and in general, we need to collect and synthesize far more information than a mere diagnosis. Moreover, knowing what diagnostic categories someone's problems fit into tells us nothing about why they're struggling and what to do about it. And this brings us to case conceptualization. Case conceptualization is one way that we might attempt to summarize, collect, and synthesize a full range of information about a client. The way that we're going to learn to do case conceptualization will use the cognitive behavioral model as a way to understand the full nature of a client's mental health problems and to guide treatment. Think of case conceptualization as a tool for understanding a client's mental health problems and for planning treatment for the client. That goes far beyond identifying the diagnostic criteria that people may or may not meet, and instead synthesizes a full range of important information about a client's problems and attempts to explain why those problems are occurring and what to do about them. A case conceptualization, as traditionally completed within clinical and counseling psychology, includes several domains of information about a client and their problems. First, we collect important identifying information about a client that might be relevant to their life and their present concerns, as well as to treatment. This might include things like age, employment, whether they're married or not, whether they're a student or not, race, and so on. Second, we want to identify strengths that clients might exhibit that might be an important part of their recovery or aid in the treatment process. For example, are clients highly intelligent and have good insight into their problems? Do they have good social support that might aid in their recovery? The third component or domain of information in the case conceptualization process is developing a problem list, a targeted list of the main problems the client is experiencing that are causing impairment or distress in their life. You practice this step of the case conceptualization process already when watching the clinical interview for Lucy and developing a list of her current problems. Many of you identified, for example, that Lucy is experiencing low mood, that she has lost interest in things that she used to enjoy or find pleasurable, that she's experiencing problems with her sleep, and so on. These essentially are the problems that are then targeted during psychological treatment. It is important to identify the diagnostic category that a client's concerns might fall into. But note that that diagnosis is probably less important than the list of problems developed for the problem list. Someone's problems may or may not neatly fit into various diagnostic categories. Their problems might fit into multiple categories, no category, or neatly fit into a category. But it's the problems that someone brings to therapy that are the target of treatment, not the diagnosis itself. It's also important to identify what we call precipitating factors. These are psychosocial stressors in an individual's life that are involved in the onset of the current problems the individual is experiencing. Think of these as events external to the individual in their social environment that might be leading to the development of their current problems. For Lucy, she had a stressful final exam period. Her parents were getting divorced. And both of these problems in her external environment were evolved in the onset of her current struggles with mood. It's important to identify precipitating factors because those also might be a target of treatment and intervention. Perhaps Lucy could connect with academic support services at her university in an effort to boost her studying strategies, thereby addressing one of the factors that led to the onset of her current problems. The next step is probably the most important step and the most challenging step of this process. And that involves developing a formulation to account for why the current problems are occurring. In our case, for our class, using the cognitive behavioral model as a framework to guide that formulation. The chapter that you're going to read about for this assignment by Judith Beck outlines how to develop a formulation to explain why specific problems may be occurring for a client using the cognitive behavioral model. We're going to practice developing a case formulation for Lucy during our next class meeting. And this is a skill that you're going to repeatedly practice in your teams and individually throughout the course of the semester. One of the main things that many of you wanted to learn about in this course was understanding why mental health problems occur. And that's exactly what case formulations do. They use the cognitive behavioral model to explain why specific struggles with mental health problems might be developed. And in this way, these are an idiographic strategy to understanding and explaining mental health problems. For the final step of this process, we develop a plan for treatment, identifying what specific psychological interventions to use that might address the reasons the problems are occurring that we identified in step 6 when developing the formulation of the problem. When reading the Beck chapter for this assignment, keep Lucy's case in mind and think how you might develop a formulation of Lucy's current problems using the cognitive behavioral model. In the chapter that you're going to read, Beck provides an example of this using a client, Sally, who experiences depression. And Beck uses the cognitive behavioral model to explain why Sally developed her problems with depression and why those problems continue. See if you can begin to do the same thing with Lucy and her case as an example.